How many times a day do you smile? 300? 4? How many times does that smile help you build a relationship or improve a business deal? And how would your opportunities for happiness and success be diminished if you suffered from severe pain or poor dental health? How often would you smile then? Some time ago, the World Health Organization set a global goal to reduce the number of decayed and missing teeth in children. They understood how vital oral health is to human well-being and prosperity. A decade later, 90% of the children in the Dominican Republic still suffer from dental pain. Over half the population live in rural areas where the average income is just $10 a day. Healthcare, especially dental care, is far beyond their reach. Many children in the Dominican Republic grow up never seeing a doctor or a dentist. Some have never owned a toothbrush or share one with the rest of their family, a major factor in the spread of disease. Smiles Foundation, a non-profit organization started by Canadian dental hygienist Alina Katzman in 1987, has made it its mission to bring affordable dental care and primary health education to the people of the Dominican Republic. They and their sister organization Sonrisas, Spanish for smiles, have already changed over 4 million lives.
In 1984, I went to the Dominican Republic as a tourist. Never I could have imagined at that time that the trip was going to turn into something as challenging and rewarding as Smiles Foundation. I went to the northern part of the island called Samana. Many people there spoke English. Walking around, talking to the kids, I couldn't help but notice how many people at a very young age had caries and missing teeth. When I was inquiring further, I found out that dental care was unavailable for the poor and very expensive, even for the wealthy. And that's when the idea came to do something to make a difference. I hired 2 English-speaking nurses because I didn't speak any Spanish. And we started going anywhere and everywhere people were willing to listen to us. And we started teaching them about primary health care and, of course, about dental care. And that was the beginning of Sonrisas.
Returning to Toronto, Alina decided to seek out supporters in the dental field willing to use their expertise and resources to help the children of the Dominican Republic. Her determination and persistence paid off, and in 1991, the first clinic was opened in Santo Domingo. Furnished with the donated equipment from Canada, the Sonrisas Clinic was immediately able to help people in need. In the years that followed, Alina continued to work and expand the reach of the organization, treating thousands of people in need and opening new clinics throughout the island.
Today, Sonrisas operates 10 permanent dental clinics all over the island. Each clinic is equipped from 4 to 12 dental chairs in each, X-ray area, compressor, generator, sterilization area, modern equipment to provide a variety of dental care. Currently, Sonrisas operates 2 fully equipped dental mobile clinics that have 2 chairs in each, its own generator, compressor, suction unit, X-ray, sterilization area. So it's a real clinic on wheels. These clinics travel to the remote areas of the island where permanent care is not available and where people just have no way of getting to the permanent dental clinics. And this type of service is essential. Also, we have 5 portable mobile chairs that our permanent clinics use to deliver field trips to different areas.
Through affordable co-payments from adult patients and donations of equipment and materials, Sonrisas has been able to become a sustainable resource for the communities it serves. This structure allows children to be treated free of charge and covers all utilities, essential materials, and employee wages.
Education programs are huge, and all the people we treat are educated in a variety of healthcare topics, such as primary health care, abuse prevention, prevention of transmittable diseases, prevention of AIDS transmission, breastfeeding, family planning, bullying, abuse prevention of women and children, and of course, dental care.
Sonrisas is not only important to the community, I believe that it is necessary. Most of the kids that come here simply could not afford to go to a dentist clinic anywhere else. We provide very professional service with a lot of love. It is economical and very hygienic.
Not only is Sonrisas bringing sustainable oral health care to a nation in need, they are also creating jobs and educational opportunities that are helping lift the population out of poverty. Some have started as assistants and ended up as trained dentists or become clinic supervisors.
One day, Mrs. Alina asked me if I would like to learn technical skills and how to maintain and install dental equipment in the clinics. I said, sure, why not? She had me travel to Canada to learn the skill, and today I am a technician. Sonrisas has opened up its doors to me and given me this incredible opportunity. All I am today is thanks to Sonrisas. My life is Sonrisas. My light is Sonrisas. I live because of Sonrisas.
I have been working with Sonrisas now for 17 years, the last 15 years as the supervisor of the clinic in Mocha. We have an excellent team of 6 dentists. One of the things that I insist on when I am hiring a new dentist is that they must love working with kids. We want the children to be treated with care and affection. The other important thing is proficiency. Our dentists have kept updating their skills until we have now reached a point where we do not have to refer our patients out. We are now able to perform all of the specialized services right here at our clinic.
I started working at Sonrisas in 1995 as an accountant. I have continued to work there because I believe that everyone must do something for their country, and I know that working at Sonrisas satisfies that responsibility. Even after I obtained a degree in law, I decided to stay on with Sonrisas because I know I will find much more personal fulfillment working here than I ever would working in the business sector.
There has been a lot of support within the Dominican Republic to help continue Alina's work and expand its reach.
A lot of Dominican businesses and Dominican individuals have opened their hearts to Sonrisas and have been helping us through the board, through the volunteer group, through personal donations and contributions through the years. So I'm very grateful to the Dominican people for opening their hearts and making Sonrisas their own.
Everywhere I go, I encourage people to get to know Sonrisas so that they can fall in love with it, like everyone else has that has become involved. We are always enlisting new young people so that we can keep this program alive.
Being around for almost 30 years, a lot of our patients today have become parents and grandparents, so they continue bringing their children and grandchildren to the clinics. So Sonrisas has become a part of Dominican culture, part of Dominican families.
I feel very grateful for Sonrisas. I have gone to Sonrisas, my children have all gone to Sonrisas, and now my grandchildren are being treated there. Life has not been easy for us living in this community. There are very few jobs, and I receive no pension. We have no money to take our children to a dentist. We are very grateful that Sonrisas provides these services for free.
I have been a patient in Sonrisas since I was 6 years old. When I had teeth that needed to be pulled, they pulled them. I am very thankful Sonrisas exists, and I tell all my friends that they should go there so they too can have a healthy smile.
I have been a patient in Sonrisas since I was 5 years old. I got my teeth cleaned there and I learned how to brush correctly. Because of this, I have never had a cavity. My brother just got braces, and in a few years, I probably will too. The dentists are very kind and caring. They treat us very well, and even if they have to pull out a tooth, they do it in a way that doesn't hurt. I tell all my friends to go to Sonrisas.
My child was born with 4 different heart problems and was not expected to survive 24 hours. Fortunately, he lived, but he has had to be hospitalized many times because of his condition. Financially, it has been very difficult for us to meet all of these expenses. We are extremely grateful to Sonrisas for the way they have helped my Emilio. Dental care is usually so expensive, and yet at Sonrisas everything has been free. For that, we are very thankful.
The Smiles Foundation has been blessed to receive support from many Canadian international institutions and organizations that understand how important dental health is to the well-being and future prosperity of the people of the Dominican Republic. But there is a lot more to do.
I would love to see Sonrisas Clinic in every poor city and town of the Dominican Republic. I would love to have enough funds to have mobile clinics deliver such needed services to the remote areas of the island. Many years ago, we started the first CompuCom project, which is computer education classes for troubled youth. I would love to have CompuCom in every clinic that Sonrisas has, but we need a lot of funds in order to make that a reality. We also need cash donations in order to purchase materials and supplies that were not donated, and we could do it locally to avoid shipping costs. Every container we send from Canada to the Dominican Republic costs around $6,000. We need that money in order to be able to send donations from Canada to the Dominican Republic. I also would love to have more volunteers giving their time in our Canadian offices, as well as Spanish-speaking volunteers helping out in the Dominican Republic. I personally find that once you start doing something good in life, you just can't stop. You want to do more and more, especially when you see that it's making a difference in somebody's life. I really believe that we as human beings are like angels, but only with one wing. And the only way we can fly, if we hold on to each other, ask each other for help, and with divine guidance, we start making a difference together. I would like to thank every human being, every company, every institution that have opened their hearts in order to make Sonrisas a reality. I think that every father and every mother would like to see a happy and healthy smile on their child's face. Some people are fortunate to be able to give it to their children, while others cannot. Together, we can join our efforts, and with lots of love and open hearts, we can bring healthy, happy smiles, and by that, give a healthy and happy, prosperous future to a needy child today.